Hi, I'm Alan Bienstock. I'm a board-certified plastic and reconstructive surgeon. My expertise is wound care. In previous videos and sessions, we've always opened with a question. Well, now we're doing a whole session of live videos, meaning me actually seeing the patient and doing the wound care. I want to give you background on the next patient. She's a 73-year-old female with a history of dementia. She had a pathologic fracture. She's deteriorated over the past 3 to 6 years. She's become bedbound and homebound. She developed non-healing wounds of her sacrum and her left hip. I've been treating her for the past 3 years. We've done multiple surgical debridements of the wounds because they were necrotic and infected. But that means I cut out all the bad tissue because they were infected. They had a foul odor. We put the patient on antibiotics. We did different wound care regimens, including debridement, as well as doing hydroferro blue, which we'll talk about in other videos, Aquacell AG. We did negative pressure therapy or vac therapy, which is a sponge hooked up to a machine that takes out all of the fluid out, or exudate, which has all the bacteria in the biofilm, as well as enhances the angiogenesis or blood flow to the wound and helps contract the wound. We did this for a long while in both wounds. We stopped doing it after the wound kind of plateaued and stagnated. We've done multiple surgical debridements after this to stimulate new tissue growth on the sacrum, which is the one on the coccyx area on the back. Because the wound stalled and it was a very chronic wound, I actually did a skin substitute, which is a biologic dressing made of placenta. We did this on several sessions, at least 4 sessions. We did get it better, but then it plateaued. We've been using collagen on this wound. In addition to the one on the left hip, I actually tried to close over a drain. I mean, I debrided it and did move the tissue over, close it over a drain, which takes the fluid out as well as helps the tissue heal. This broke down because one of the caregivers had the patient on that hip and there was pressure on it and the whole thing broke down. So I was struggling for a few years on this. We elected to pursue a Clinitron bed, which is a group 3 bed. It's a sand bed, meaning it has floating sand and there's virtually no pressure on the bed. These are great beds, even though there's a lot of large learning curve for them when patient have multiple pressure holds. It's very hard if you have multiple wounds, meaning you're trying to eliminate pressure on the wounds. When you have 2 wounds, I mean, you can't keep the person on the opposite hip for the whole day. You have to, one of the wounds has to be sacrificed at some point of the day, which means there's not 100% pressure relief. The Clinitron bed helps relieve this if it's working 100% correctly, which most of the time it is if we've gone over all the instructions with the family and the caregivers. Once we started the Clinitron bed, which we did a few months ago in this patient, the one on the sacrum with the coccyx healed. Now we're struggling with the left hip, which will require most likely another surgical debridement to stimulate what we call angiogenesis or new blood tissue growth, as well as new tissue to heal from the inside out or from the depth. In this video that I'm going to show you, I'm showing you addressing the wounds, and I would love you to leave questions and commentary below, as well as make sure you subscribe to the channel and share with all your friends and colleagues. Thank you so much.